You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
My name is Pam Hansen. I'm the program director at the University of Utah, and I want to thank the PM&R Scholars for hosting this event tonight. It's a great way for medical students to learn about some of the different programs. And for all of you medical students out there, PM&R is a wonderful and exciting field with so many opportunities for innovation ahead of us. So you've got an exciting career ahead of you. I will try to run through my presentation pretty quickly and give you time to ask questions. We've got a lot of information on our website and a lot of videos showing the different areas of our program. So please check that out. It really covers a lot of information. I'll buzz through some of the key components of our training program tonight. Just a bit about myself. I'm originally from Minnesota. I went to medical school at Northwestern in Chicago, and PM&R was a required rotation, and I had not heard of it prior to that. But I started doing a couple rotations and I fell in love with it. I ended up doing my residency training at the University of Washington and came here to the University of Utah to do a sports medicine fellowship, and absolutely fell in love with both all of the outdoor recreation as well as the academic institution. So the University of Utah is a really amazing place to work. It's a great environment. We have been named one of Forbes' best employers for diversity. We have been ranked first for Utah 8 times in a year now by US News and World Report. We have been designated as an LGBTQ healthcare equity top provider, which recognizes us for commitment to providing inclusive care for all. And for 11 years in a row, Vizient has ranked us as in the nation's top 10 for healthcare among leading academic medical centers. So it truly is a great environment to work. We have also been ranked very highly as one of America's best employers for women. So that's just a little bit about the culture and the environment here at the university. In terms of PM&R, we recently opened a beautiful new 75-bed rehabilitation hospital. We're at about 50 patients right now, but are gradually increasing the numbers of providers here, and eventually we'll be up to 75 patients. The hospital is beautiful, state of the art. The design of the hospital is incredible, and the therapy equipment really helps optimize independence in our patients and provides a great environment for our residents to work. The University of Utah itself, we're at about 4,200 feet of elevation, and we've got the Wasatch Range in our backyard, which is about 12,000 feet. We've got lots of recreation surrounding us. So 11 world-class ski areas within an hour, 7 national parks within 5 hours, 7 national monuments, numerous wilderness areas and national forests. There's a lot of beautiful parks scattered throughout the city, and it's really a beautiful place to live. I like to think of it as the playground of the world. And that's one of the things that has kept me here. In terms of training here, it's a great place to learn. You work collaboratively alongside many other specialties with other residents, fellows, and medical students, and lots of opportunities to learn from each other and to teach. So it's a great learning environment. There's 28 residency programs, 66 accredited fellowships, and 27 non-accredited fellowships. For our residency program, we've been around for a long time. We were initially founded in 1965 So we're very well established and integrated into the hospital, but yet we're a small enough program to be very flexible. We have 6 to 7 residents per class, and we are all categorical. So you get to do that first year here, which provides a benefit in the fact that you're meeting your peers who you're going to be consulting on in the upcoming years. So, and you get a really solid year of internal medicine. It provides diverse training at many different sites. So, including not just Nielsen Rehabilitation Hospital, but we have 7 residents at a time at our VA. We have Primary Children's Hospital in all of these sites. All of these primary sites are within about 1.5 miles of each other. We have the Orthopedic Center. We have the Cancer Center, Huntsman Cancer Hospital, that's literally right behind us from the Nielsen Rehabilitation Hospital. And you also have opportunities to work at different community clinics. Our goal here is to provide the highest quality, comprehensive training in physical medicine and rehabilitation. And we strive to maintain a positive learning and working environment and teach with positive reinforcement and clear feedback. We've got great faculty. We've got more faculty than residents, so it's a good ratio for learning. Our faculty are very compassionate, dedicated, motivated, and really love to work with residents. In terms of our alumni, we are scattered across the country. So you're well prepared for any fellowship or job across the country after graduation. And it appears that we're everywhere, but kind of the North Dakota to Florida corridor, we're lacking a few people. So if anyone's interested in practicing in those areas after graduation, it'll help us fill in the map. In terms of where our residents go, the trend in the last couple of years, it seems like more people have been doing fellowships. So this last year, 4 of our 5 residents did fellowships and 1 took up a private practice job in Minnesota. The year prior to that, 3 of our 5 did fellowships. So it varies from year to year, but I think this represents that our residents feel comfortable going into a multitude of different fellowships as well as jobs right after graduation. We do have several different fellowships. Our longest standing fellowship is the Sports Medicine Fellowship. Stuart Willick directs that. And this has been in existence since 2001. There's 5 fellows, 2 are family practice, 1 is ER, and 2 are PM&R. We have a spinal cord injury medicine fellowship run by Dr. Rosenbluth, and that's just 1 fellow per year. We have an interventional spine fellowship run by Dr. McCormick, and this year we took 3 spine fellows. We also have a research fellowship and have had just a couple residents come through that so far. We also have rehab psychology, neuropsychology, and bariatric psychology fellowships. We have 25 residents right now. Next year, we'll be going up to 26. And I think I mentioned before, we have 32 full-time faculty. And all of our rotation sites are within 1.5 mile radius. And that's pretty unique to a residency training program. A lot of our residents live close by and use public transportation or bike to work. So it's pretty convenient. We do have required 4 hours of didactic time per week on Thursday mornings, and that's protected time. So pages are forwarded to faculty. We also have journal clubs at each site. So where I work at the Orthopedic Center, we have a Tuesday morning sports medicine journal club and Thursday morning spine journal club. They have their own journal club at the VA on Tuesdays at noons, and at Nielsen Rehabilitation Hospital Wednesdays at noons. So we all have a lot of kind of didactics at our own sites. We do have monthly grand rounds. We have a quarterly clinical safety case conference series. And we also have residents who give kind of a grand rounds. We call them senior symposiums, but it's a grand rounds forum for the faculty. I'll talk about the scholarly activity in a minute. We do have elective time, and largely that's kind of helping design your own schedule as you're moving up in years. So there's different people who want to do inpatient, outpatient, who have preferences. So that's shared in the creation of the schedule. And we also have a month that is completely yours to decide what you want to do. It is approved through our PEC, but it's largely driven by whatever you want to do. There's also protected research time for residents who choose to be in a research track in which you have a mentor. You present at our for our research team quarterly to keep them updated on your projects, and you get a dedicated half day per week of time dedicated to your research. And really that's just for a handful of residents who really want research to be part of their career as they progress. We do not have overnight call from home anymore. We've kind of restructured that to have a night shift rotation, which has been really loved by the residents, by the nursing staff, to have somebody here at night. And that's a 2-week rotation. That's a 2-week block at a time. In terms of scholarly activity, it doesn't have to be research. It can be research, it can be case reviews, quality improvement projects, or other scholarly work that's disseminated on a national platform. We do have mentors for each of you specifically for scholarly activity and research. We do have a research didactic module and a lot of resources available from our research team to help with IRB, to help with the literature search, to kind of help guide throughout the way, as well as classes on how to write grants and things like that. We also have a quality improvement didactic module. So it includes both a didactic component, but also an experiential project that we do as a class every year. So you'll be doing at least 3 of those throughout your training here. We have a robust GME and PM&R wellness program. So Rob Davies is pictured in the top left, and he's our GME wellness director. He's a psychologist. He spends time with our residents a couple hours every quarter and does activities with them. He's an amazing guy. He's actually, I just ran into him last week, and he's training for a 100-miler. He's a really, really positive energy. These are pictures below of our resident wellness champions. So Susan, Justin, and Shanna Lee. And we also have faculty wellness champions who meet regularly. So it's a positive working environment. We get together frequently. The residents get together frequently to participate in activities together. And we really focus on trying to create an environment of teamwork and making things efficient so that it makes work a pleasant place to come. Dr. STEINBERG has been our chair now since 2018. He's exceptionally supportive of our training programs and very involved. I think if you join us for Wasatch Wednesdays, he's usually on and always trying to engage with medical students. He loves the whole admissions process. He's part of our recruitment team and does some of our interviews. He's very involved with the PEC. And he also directs the university senior rotation here. So he works closely with the trainees. In terms of our rotations, here at Nielsen, we have 4 inpatient services, which are primarily a stroke service, TBI service, spinal cord injury service, and an amputee service. There's a consult service with a consult resident. We have a clinic resident, and then we started a new university senior position, which is highly valued by all the residents here. They love that. It's an opportunity to teach and kind of oversee some of the different services, and it's been a great experience for the seniors, as well as I think providing a lot for the other residents here. Over at the orthopedic center, we have 2 residents at a time, one on the spine rotation and one on the sports rotation. And at the orthopedic center, you work in a wide variety of clinics. You're with somebody different every day. So you see a lot of different approaches to a lot of different management styles. You get good exposure to procedures, ultrasound, fluoroscopic, EMGs. At the VA hospital, there's many opportunities for clinic spasticity. You get a lot of EMGs there. There's a variety of musculoskeletal clinics with a lot of ultrasound, amputee care. There's also an inpatient service there. So lots of great opportunities at the VA. You get a minimum of 2 months at Primary Children's Hospital, which is a split inpatient, outpatient rotation. And there's 5 faculty there. It's a great opportunity for learning, great teaching. And then the elective month, as I had discussed previously. In terms of our didactic curriculum, we have an 18-month cycle, and it's broken into different modules that are listed here. We do have a good ultrasound training course. There is an EMG boot camp every year. We also have kind of newer modules that we've incorporated based on resident feedback. In terms of business of management, practice management, those practical things for when you graduate. I've already talked about the journal clubs and grand rounds. We do have faculty mentors assigned for each resident. And these are faculty who raise their hand and want to be mentors. They're not made to be mentors. They love it. They meet with you quarterly for your first year and at least semi-annually after that. A lot of times residents find a natural mentor in a different faculty member as they go through, and that's fine. We just want to make sure you've got good support all the way through. This year, the residents have also started a more senior junior mentorship program amongst the residents. That's been wonderful. So overall, we've got a really balanced training program covering the entire scope of PM&R, from level 1 trauma centers to our community clinics. We have excellent procedural training, again, EMGs, ultrasound, fluoroscopy, baclofen pumps, really kind of across the board at all the different institutions. There's great opportunities for sports coverage and adaptive sports coverage through the Trails program, which was featured on our last Wasatch Wednesday. I hope some of you got to see that, but it's also on our website if you want to check that out. We've got a comprehensive didactic curriculum that's faculty driven, faculty run, a devotion to scholarly activity and quality improvement, dedication to a high quality of learning. And we really have just a wonderful, warm group of residents and faculty. And living in the Wasatch, it's a great quality of life with all the recreation. So these are just a few pictures of some of the sports coverage and some of our awesome residents. I hope that some of you can join us. We have Wasatch Wednesdays. The dates are listed here. We just finished our first one, which was on our spinal cord injury program. Our next one is coming up on September 1st for, there's going to be a discussion of our amputee program. And the residents always talk a little bit about life in Salt Lake. So it's a good time to get to know our residents a little bit and ask any questions. And I have not been watching the chat as I've been talking, so I'm happy to answer any questions. And we've got some residents from here too to help field any questions you might have. Cost of living. I'm seeing there's a question on what is cost of living like. It's like everywhere in the country, it's definitely gone up this last year. Residents, please correct me if I'm wrong, because I haven't rented for a while, but in Nick's recent presentation last Wednesday, I think he priced things out. It's between $800 to $1,500, kind of depending on the area you live and the how many bedrooms, etc. But it's oftentimes in that range. 1,500 is pretty high, 800 is pretty low.
what sports are in the Trails program?
Sports in the Trails program. Is Casey on by chance to talk about the Trails program at all? There's adaptive skiing, there's kayaking, biking. Those are to name a few, but Casey is one of our R2s who's been involved volunteering for the Trails program for like the last decade. And he gave a really nice talk about the Trails program last Wednesday. Is that recorded?
Yes.
Which is recorded, so you can take a look at that too. But lots of opportunities for residents there.
Speak a little bit about the structure of PGY1. Are there any specific electives for residents?
In the PGY 1 year, the elective month is really spent with PM&R. There's also opportunities for geriatrics, and you work with some of the PM&R faculty during that rotation as well, so you get to know us. You're part of the internal medicine program, so it's largely run by internal medicine, but you do get opportunities to engage with the PM&R faculty and residents during that year. And we have a bunch of different events as well, social events where we connect and get to spend time with one another.
Can you tell us more about the POWER program?
The POWER program is a program that I started actually right after my fellowship year here. I was seeing a lot of women with shoulder issues after being treated for breast cancer, and spent some time shadowing up at the oncology clinics and kind of tried to get a sense for what patients were being told, how they were guided through cancer treatment, and realized there really wasn't any guidance, and they wanted to do the right thing, but they didn't know what to be doing, didn't feel comfortable, didn't feel safe. So we developed, I developed the POWER program, and it just started seeing about 2 patients per week, creating individualized exercise programs for cancer patients, and progressing them along through their treatment to help keep them strong, to mitigate fatigue, loss of strength. Then we recruited a couple dietitians to work with us. And now it's got acupuncture, massage, arts, music therapy. We have additional PM&R faculty that treating all cancer types for their rehabilitation needs. And we see thousands of patients every year. So it's grown tremendously. And it's a highlight of what I do every week.
George, did we run out of time?
Yeah, unfortunately, we're up against the clock here, but that's okay. I didn't want to cut you off. It was a fantastic presentation. You're more than welcome to stay on and answer questions in the chat as well. We definitely thank you for being here. It was a great presentation.
Thank you so much for hosting this.
No problem.